sometimes we make those like decisions on whether like a patient should like be hospitalized like in an ICU or like should be able to go home within like the first like 30 seconds to like 1 minute of like kind of assessing them.
Hi, I'm Dr. Katie Patel, and this is your emergency medicine colleague consult. So, good morning, Priam. Thank you so much for talking with me today.
Good morning. Currently working as an ER attending at two different hospitals in the New York Queens area, and I work as a nocturnist, so I do night shifts only.
Can you tell me just a little bit about what made you interested in emergency medicine?
Yeah, of course. I was, in terms of my decision, it was quite late compared to some other people. I didn't have too much experience. Like I was never, a lot of people who do become interested in emergency medicine were either like a medic or an ER scribe, so they had some sort of exposure. For me, the first time I really got any sort of exposure to it was during my third year, during one of like the last electives I had. And it kind of just worked out because I was at this point where I was kind of interested in a lot of things. Like I really liked medicine, but I like liked seeing children too. Um, and I was kind of struggling to like figure out which one I liked the best. So I think the elective came at the right time because it was one of those things where I realized that I would get to keep a lot of what I was interested in. And I also see like critical. I knew I didn't really want to work in a clinic setting and I wanted to work kind of like in a hospital setting. So emergency medicine kind of seemed like the right fit when I first rotated through it.
So, one thing about emergency medicine that and applying to emergency medicine residency that comes up and is really unique is the concept of a slow. So, could you tell us like what is a slow even and what does that mean?
It was basically created to kind of create a concise and kind of standardized way to evaluate all people who rotate through an EM clerkship. It stands for Standardized Letter of Evaluation. There's categories that kind of just list different characteristics attendings and like program directors look for in EM residents. And then you get kind of a score in each of those categories. And that makes it easier kind of to compare you to any other student applying or rotating through the emergency department. Because a lot of times letters of evaluation are kind of vague and it just kind of keeps that from happening with this.
Like who fills out a slow? Is that can you only get a slow from an emergency medicine attending, or does it come from any clerkship that you've been on?
It is better to be able to get those letters of evaluation from EM clerkships that you do. You can put in letters of recommendation otherwise towards your application as well from other specialties. But I think the ones in emergency medicine are weighed a little bit heavier just because you're comparing like oranges to oranges at that point.
So let's say that a medical student is starting on their emergency medicine rotation, you're there attending, they want to go into emergency
Mhm.
medicine, they want to ask you for a slow, but they want it to look amazing. What could they do during their time with you to really stand out and impress you?
Yeah, so there's a few things. I think just I know the emergency room can be kind of intimidating in the beginning, but I think just like being a team player and like helping out when possible helps you stand out a lot. And I think the one thing I think we often get in this rhythm of we like see a new patient, we present it, but students who rotate through and like always go reassess their patient, go like check on them again. I think that always stands out because I think that's something that we like forget that it's kind of our role in the emergency room to kind of just reassess within that time. And I know it's hard because sometimes you just want to go see a new patient and then present that to like expand your knowledge and just like show what you do know about like different diagnoses and things. So I think reassessing your patients and just kind of like helping out where you can during a busy shift help you stand out a lot.
What should a medical student avoid doing?
I think that just self-awareness and like humility go a long way. So I think just keeping those things in mind. I think one thing to avoid is you never want to actively like try to overshadow anyone else that you're trying to do a clerkship with. Because at the end of the day, like those will be your like co-residents and like I know it's hard to say like stand out, but also make sure you're not like stepping over anyone. I think like just making sure that like even with your like the people you're rotating with, it's like you show that you're like friendly with them and like not trying to like overstep or like show off or anything like that.
Yeah. Let's say that a medical student is wanting to really read up on things, but wants them from an emergency physician's perspective, or they want something that they could carry in their white coat or refer to in between patients. Do you have any resources that you like recommending to your medical students?
Yeah, there's quite a few. MRAP has a great like kind of podcasts on general like medical emergency medicine knowledge. Look at Rebel EM. It often covers articles that were recently published within emergency medicine and kind of summarizes it. So it's not, you're not like going through 15, 16 pages of a journal article. It kind of gives you the overall gist of it. So I think that helps and looks impressive to kind of keep up with the most up to date emergency medicine literature. And then some of the other ones that I think even help during residency are things like EM Crit, which a lot of like the emergency medicine, like critical care things, the more complex things that you come across like later on in training or when you're a senior and like working the critical section. EM Crit is a great resource too. So I think those three help. And then even just like looking up like the next steps when you're trying to figure out how to present, if you use like WikEM, which is run by I think like one of the LA emergency medicine programs, has kind of like a quick and easy like this is if this is the diagnosis you're suspecting, like these are the differentials to consider and like these are the things to order. That's like the intro to it, and the rest of it should kind of back up the knowledge that you have.
What do you think emergency medicine teaches you that every doctor should know?
I think one of the big ones is just being able to determine like sick versus not sick. And I think the other thing is just all emergency medicine providers have to be very good at history taking because you're like the first person gathering any sort of information, right? So oftentimes when a patient was already presented to you and you're like on a different like specialty service, you already have the background information that the emergency provider was able to like dig up and like kind of get the story out of a patient to figure out what's going on. So those two skills, I think what like regardless of what you go into are useful in an EM clerkship.
Well, thank you so much, Priam. I really appreciate you
Yep.
taking the time, helping us know a little bit more about what goes into EM clerkship and applying for residency.